Well, I'm very interested in continuing exactly what we've been doing and what we promised we would do, which is focus on 5 priorities, which is low taxes and balanced budget. And that's where we go to the next issue, which of course is healthcare, and that is our second priority, healthcare and seniors care. And we believe that healthcare has not been the focus of this government, along with education, because education is the one thing that if we get it right, it pays dividends for hundreds of years. And just 15 years ago we were #1 in the world, and today we're #5 in Canada. As well, we need to concentrate on democracy and accountability. And that's why that's our 4th priority, is because we believe that the government is broken. Our 5th priority is dealing with communities in rural Alberta and urban Alberta, making sure that the communities are healthy, making sure that we have a good manufacturing sector, a good resource sector, a good agricultural sector, and focusing on our economy, because if we have a healthy rural Alberta, we'll have a healthy urban Alberta.
Do you see challenges in Edmonton specifically?
Well, of course.
In the last election and polls.
Of course I do. I moved to Edmonton in November, and I've had an opportunity to speak to many Edmontonians, and I think they've been more disillusioned than any in relation to government. I lived here. When we moved to Alberta, we first stopped in Edmonton and lived here for a period of time. So I have tremendous connections here. My 2 grandchildren are here, and 2 of my sons live here.
On health, your wait times guarantee has been criticized for not taking into account the out-of-pocket expenses that would come when people are recovering from surgery. Weeks out of province, out of country, having to spend recovering from hip replacement could be up to 6 weeks. They'd be on the hook for that. How do you respond to criticism that it's not a plan for all Albertans?
Well, it is a plan for all Albertans because it's going to reduce wait times. And when it comes to healthcare, what we're talking about is wait times. And what I don't think is acceptable is when people have to sit waiting 20 weeks for hip surgery. It doesn't cost any more to do it today than it does in 20 weeks. And do I think it's acceptable that people go out of the country or out of the province to get these surgeries and procedures? Absolutely not. But do I think it's acceptable that they have to wait double the time that they should under independent organizations' assessments of how long it should take? I think that's even more horrendous. People suffering and staying at home and not being productive and going through all these issues costs us much, much more than what it'll cost to go out of country or out of province. And you know what? So be it if it costs people that much money, because it'll relieve the wait times for the people that actually need it and can't afford it. Who's got another option? Have we seen any of the other parties have the guts to come forward with any kind of option? No. That's because they think business as usual and throwing money at it will solve it. It won't solve it. The consultancy budgets are crazy. And as I mentioned, there's more communication staff in the government of Alberta than there is in your entire organization here. There's more people that are communications experts with the government than we have reporters in Alberta. Any money that is saved within more than what we budgeted here will go to frontline. And that means not just workers, not just nurses, not just doctors, but it means actually in tools that they need to get done.
So is what you saw when your son was in hospital, did that influence the entire party's policy on healthcare? Is what you went through personally?
Yes. I looked at the platform first of all, and it was always in the platform to reform healthcare and to make it better. I'm not interested in 2-tier healthcare, just to be honest. I'm not interested in privatizing healthcare. I think that's ludicrous. What I am interested in is lowering wait times and making sure people are better. But did it influence me? Absolutely. I saw that the nurses and doctors did a great job. They were fantastic. But the system is broken. They're disorganized. Nobody's in charge. There's, the amount of... I had 3 specialists fighting in front of my son. I had 3 specialists arguing in front of my son that he had 3 different diseases, all of which would kill him within 2 to 10 years. And I don't think it's appropriate for people to do that kind of thing. I think that's wrong, and it clearly indicated to me 2 things: that they had too much time on their hands, and secondly, they had no bedside manner and professionalism to deal with somebody that was sick. So I understand medical charts, and I have flow charts from everything they did, and I haven't started any litigation, and I won't be, because I don't care about the money, because my son's gone, but I promised him I'd fix it.
In 2012, I understand the fiscal circumstances in the province were quite different, but the party did have an idea for Danny Dollars. Would we see Brian Bucks under surplus?
First of all, the first thing is that any government that labels something behind the leader doesn't understand that it takes a team to run a province. It takes a team that works together to focus on what's necessary. Brian, it's not about Brian, just like it shouldn't have been about Danielle. I will never agree to anything like that or anything similar to that. And the first thing is I wouldn't introduce a stupid plan like Danny Bucks. That's just not smart at all.